Hello and welcome to another episode of Conversations with Alison J, The Journey to Here. I'm Alison J. Please remember to subscribe to the channel, like the videos and share. Today we're going to be talking about menstruation and menopause, the Shake Africa project with Ifewumi Fagunwa. Wumi, as she likes to be called, is an award-winning medical doctor, obtaining her medical degree from University College London, UCL, and a neuroscience graduate from King's College London. She has a long-standing interest in women's rights and sexual and reproductive health, and is the founder of Shake Africa, a non-profit committed to improving women's health outcomes in Africa and the diaspora. She also sits on the Young Women's Advisory Council for Forward UK, the leading African women-led organisation working to end violence against women and girls. She is an academic future scholar and NDPH scholar at the University of Oxford, where she will be commencing a Master's in Global Health Science and Epidemiology. As a result of her advocacy work, she has been recognised as one of the top 5 rising stars in healthcare in the UK. Hello, Wumi. Thank you so much for joining us here on Conversations with Alison J, The Journey to Here. I'm quite excited to be having this conversation with you today because menstruation and menopause is something that I've wanted to cover for quite a while. And it's strange how it's such almost a taboo subject, even among women. Now, I first connected with you after I saw an event advertised called Martini's Menstruation and Menopause. And I reached out to you instantly because, as I mentioned, it's a subject I wanted to cover. But then the more I looked into your background and what you did, I found out about what you do with Shake Africa and the work you're doing there to help women's rights and women's health, sexual health and reproductive rights. And definitely, absolutely wanted to speak to you more about that. Now, as women of menstruating age, and we also know that menstruation means period. There are some people that don't understand or know that the two are the same thing. So for the ease of everybody listening, so many of us are struggling. We are, for many, being able to present every day, show up every day and work at your full capacity while experiencing the most excruciating cramps, abdominal pains, period pains, extremely heavy flow. In some cases, as in I know with myself, the medical profession described my flow as flooding. It was that bad and not wanting anyone to know. So you're going through that and you're still trying to show up every day, not wanting anyone to know. It's nothing short of a real struggle. And although it can impact performance, many of us, we've actually been able to, only God knows how, but push through in such a way that no one's none the wiser. So, Wumi, as you'd like to be known, please tell us, why are you focusing on menstruation and menopause? After all, as I mentioned, it's not a topic that people comfortably speaking about, even between women.
And that's exactly why I've chosen to speak about menstruation and menopause, because it's something that women don't comfortably speak about, men don't comfortably speak about, the world just, doesn't comfortably speak about it. And for me, that doesn't make sense because most people who are born female will menstruate. And so that's pretty much like 50% of the world's population. So why is this something we won't speak about? If this was a men's health issue, we'd be speaking about it. So why can't we speak about women's health? And one of the key issues that I have with things surrounding menstruation and menopause is that if people don't know about menstruation, if they don't know what it's meant to, quote unquote, what's normal, then how do they know when something's going wrong? How do they know when they need to seek out medical advice? How do they know when to speak to their doctors? And there's this normalization of pain and just thinking that we just have to grin and bear it whenever we have our periods and we go through excruciating pain, and people say, oh, that's part and parcel, that's just what happens when you have periods. And actually, well, no, it doesn't have to be like that. And if we continue to do that, we continue to push women into a situation where they have to, you know, as you said, they have to go through excruciating pain, and then they have to go through life just like everybody else, and act like nothing's happening. And I just don't think that's fair.
Thank you so much for that. And I'm glad that you mentioned the fact of normalizing pain, that it's the expected. It almost like, if for you to have period pain, the more excruciating, the better, like it's a rite of passage. And
exactly.
And that's and the more that you learn, the more you look into it, and the more that, and it's quite interesting because sometimes the conversations happen not because you're just sitting around having a conversation about your period. But I remember many years ago, when I was at college, I was working for a retail chain, and my period came, and it was so heavy that I needed to change quite frequently. But we were training, and the trainer, she was not that soft, let's put it that way. But I really needed to excuse myself. And I was like, oh my gosh, I'm about to have an accident here. I need to excuse myself. So I whispered to her to ask if I could excuse myself. And I basically explained, like, look, it's not going to be great if I'm not allowed to excuse myself. And her response to me was, oh, you go through that, do you? I was like, yes, doesn't everyone? She's like, no, I didn't know my period's there until I go to the bathroom one day and, oh, there it is. I wanted to snatch her face off. I'm just like, hold on, wait, what? Like, no, hold on, sorry. You actually don't go through excruciating pain. You don't actually feel like you're dying and your entire life force is leaving you. She's like, no. And I just thought, so all of this pain and this heavy flow isn't normal then. So, and that's one of the reasons why I wanted to really delve into this, because, periods can vary between one woman and another, right? Many of us have heard of endometriosis, which is a condition in which the endometrial tissue, the inner lining of the uterus, grows on the outside of the uterus. And that can be extremely painful, cause heavy bleeding. And thanks to Gabrielle Union, I wish she'd spoken up 15 years ago, but we won't go into that. We've also been made aware of adenomyosis, which is something I was diagnosed with, which occurs in the tissue that normally lines the uterus, the endometrial tissue. Unlike endometriosis, it doesn't grow on the outside, but it actually grows into the muscular wall of the uterus, which again can cause painful or heavy prolonged periods, clotting, abdominal and pelvic pain. Please, woman, can you please tell us that with all of these things that are known, why is it that when we go to the doctor presenting with extremely heavy flow, excruciating pain, really severe symptoms, because all of these, there's medical terms for these symptoms as well, but why is it like we have to call down God for them to even remotely take us seriously in this day and age of medical advancements, technology? We still have to beg and plead as women for our concerns to be addressed.
So I'm really glad you asked that question, because that's a question that I ask myself every day, and a question that a lot of women are asking. And honestly, I think a lot of it is rooted in patriarchy. Unfortunately, medicine is very patriarchal. I mean, obviously, we've sort of moved away from the way it was in the olden days, but it is still pretty patriarchal. And with that in mind, like I said earlier, women's health issues are just not seen as important. And if they're not as important, the research into them is not there. The funding for the research is not there. The knowledge about these conditions is not there. And that becomes a real issue. If the people that are providing medical care are not well versed on these issues, or if they carry some of the biases that we as a society carry around women's health, around women's pain, then these things just aren't taken seriously in the same way. And as we've spoken about, you know, this thing of normalizing pain in women, like period pain, you know, people will just be like, yeah, well, that's just what happens when you get a period. And then you're sort of expected, oh yeah, I've got heavy bleeding. Yeah, well, you know, you bleed on periods. Like, what do you expect? Well, as you said, not everybody experiences that. And it's only now that there's a shift, there's more of a shift towards people understanding that actually some of these things aren't normal. Some of these things, you know, that there are conditions that are associated with that. And even so, me as an, so I'm a doctor, but I also, you know, I have had my fair share of experiences in terms of gynecological issues. And I know that even when I go to the doctor, sometimes it can be a bit like, hello, like, are you listening to me? And I have the knowledge, you know, and I can, and so in some ways I can advocate for myself a little bit better. But not everybody has that. Not everybody has that sort of advantage to be able to say, well, I know that this is how it presents and I know I have this. And that's why Shake Africa is there, so that people can have that knowledge. But also, as a patient, that's not your job. It's not your job to be the medical professional. It's your job to go there and say there's a problem. And it's our job to say, yes, let's find out what's going on. Yes, let's investigate it. But until we actually think more about women's health and we value women more and value their problems more, then there's not going to be a shift. And just one more thing, sorry, I could go on about this forever, but there's also this issue of race as well. And being a Black woman, you know, people then even more expect you to just tolerate pain, which I think is crazy, especially the fact that some of these conditions disproportionately affect us. So, for example, fibroids disproportionately affects Black women. So, you know, if a Black woman comes to you and says that they've got heavy periods, or they are anemic, or, you know, they're having excruciating pain, then we should be looking into it. But sometimes it's like, okay, the biases are like, okay, well, we just, you know, just take a bit of paracetamol, just take a bit of ibuprofen. But for any woman that's had an excruciating period, you know, those things are not doing anything. So yes, a lot of it is patriarchy, a lot of it is bias, and we definitely need to shift away from that.
I'm so glad you mentioned a couple of things there, Wumi, because having experienced several of those things myself, and so when I mentioned earlier that there's even names for medical terminologies for them. So prior to being diagnosed with adenomyosis, I was told that I had dysmenorrhea, which is painful cramps. And then there was another one that I was pronounced with menorrhea as well. So those two things. And it's just like, okay, so if you're telling me there's a medical term for them, can you please offer me some resources? Please offer me some guidance. I was told that given these two terms, and I ended up needing to actually look them up myself to even see what they even meant. So to your point of going into the doctors and basically not being heard. And I remember for myself, the way that I was diagnosed with adenomyosis is because after several years of my periods being so bad that I would pass out, so then people would just take me to the hospital because I'm talking about from school age, pass out at school, at work, and so on, and being taken to the hospital and going to see specialists. And I recall saving up to go to Harley Street. And for those who don't know, Harley Street is a very famous street in London where the rich and famous go to see doctors. And I remember saving up to do that. And they were looking for fibroids. Now, at the time, I didn't really have an understanding. And I'm going to show my age here because this is in the days before Google. So I couldn't just quite look it up like that. And so, and I had no understanding and I wasn't getting any help. And so when you mention about things like fibroids disproportionately affect Black women, can you elaborate a bit on that?
Yeah, so with fibroids, specifically, because those are the ones that we really know affect Black women disproportionately. So most women actually, Black, white, Puerto Rican, Asian, will develop fibroids at some point in their life. Mm-hmm. The difference with Black women is more of us develop them, and we develop them younger. So Why, we don't know. There are, there have been a few studies. I'll say a few, not enough, but there've been a few studies. There's no conclusion as to why it happened. But I even just forget the studies, even anecdotally, based off of my friends, as I've been getting older, pretty much, honestly, most of my friends that are Black have fibroids. So it is something that we know commonly. And even, I have fibroids. And even when I spoke to my doctor, he did explain to me, yes, like this happens amongst a lot of Black women. And fibroids don't always have to cause problems. Sometimes people have them and they don't know. But when people do know that they have them, things need to be done, because women are more likely to be anemic, more likely to, at some point, you have heavy periods, have painful periods, and there are solutions to that. So they should be offered.
Thank you. And sorry, I was remiss. Can you explain to us, what are fibroids?
Sure. So fibroids they're benign or non-cancerous growths on the uterus, and they can happen in various places. So they can happen sort of in the wall of the uterus, they can happen on the outside, they can actually happen within the cavity of the uterus, and essentially we don't know exactly why they grow, but they do, and they generally feed off of the uterine blood supply, and they are hormone sensitive, so they respond very much to estrogen. So that's why they affect a lot of women during their childbearing or their menstruating age, and that's why actually a lot of women sometimes get relief postmenopausally. And I don't know if you want me to go in sort of like any more about it.
Please
I can, but that's
Please do.
So so then in terms of what they can cause, so people can have various symptoms. So like I said, not everyone feels the effects of fibroids. So some people have fibroids and they just absolutely don't know about it. And some people find it incidentally on an ultrasound scan, or even when they're pregnant, they might just find, actually, yeah, they've got a couple of fibroids sitting in there. And then some people, because the thing about fibroids is about the location, so where they're based, that can affect your symptoms. So sometimes, if they're more external, sometimes people feel more of the pressure symptoms. If they're larger, they might feel more of the pressure symptoms. And when I say pressure symptoms, that could be things around pelvic pain or tummy pain. Some people experience leg pain because it can push on some nerves, back pain. It can cause abdominal bloating. And what people might notice is actually some people, their first symptom might just be that they realize that their tummy's getting bigger, and they're not quite sure exactly why that is. That could be fibroids as well. People can have growths that make them look, that they could look 24 weeks pregnant, 26 weeks pregnant, 30 weeks pregnant, all from fibroids. It can cause heavy bleeding and painful periods. And as you said, the doctor said dysmenorrhea, menorrhagia, which is exactly that. So menorrhagia is the heavy bleeding, dysmenorrhea is the painful periods. So it can cause both of those. It can give things like flooding, as you said. So some women will find they're changing their pads literally every 30 minutes. And it can go from 0 to 100. So there's nothing, and all of a sudden the pad is full. And that can be a classic symptom of fibroids. Oh gosh, the list is endless. Constipation, weeing regularly. So some women find that constipation, because it can push on the bowels, and so people can find that they're constipated. And then in terms of then it can push on the bladder. So some women find that they need to go to the toilet more frequently. And I've found that a lot of women have said that that can be a nuisance, just constantly having to go to the toilet every 20 minutes, every 30 minutes. It can be very annoying. So yeah, there's a huge list of symptoms that are associated with fibroids. A long list.
And
there are a lot of treatments.
I'm glad there's two things. I'm glad you said there's a lot of treatments, because I want you to touch briefly on what the treatments are. But one of the things I really want you to touch on is fibroids. What sizes can they range from and to?
Oh, so I can give you ballpark figures, but I do not know. And the reason I don't know is that they can literally be a huge spectrum. So they can be as little as, some people have like 1 centimeter, like very, very tiny. And then you have people, so they can be like 6 centimeters. I say those kind of like middle size, but we're getting a bit larger. Some people have 11 centimeter fibroids. And I think if you just got a ruler and looked at what 11 centimeters looks like, you will actually be able to sort of internalize like, okay, that's actually pretty big to have in your abdomen. Like, we're not huge people. So if you've got like something like that sitting in your uterus that is only like that, and people can have multiple. So people can have like an 11 centimeter and then an 8 centimeter somewhere and a 6 centimeter somewhere. There are people that have 16 fibroids. There are people that have 100 fibroids. Wow. You can have a lot as well.
So hold on 1 second. Let me get this straight. Because I just happen to have a ruler here at my desk. So when we say 11 centimeters, so that is this big. Let me do it this way. That is this big. So this could be the size of a fibroid that somebody has. And what you're saying to me is, so a woman could have an 11 centimeter fibroid, or she could have multiple of these?
So yeah, so a woman can have an 11 centimeter fibroid, and then she could have another 8 centimeter fibroid somewhere else, and then she could have another 6 centimeters somewhere else, and another 2 centimeter, and another 3 centimeter. So you can have a lot of fibroids. You can have big fibroids, small fibroids, medium fibroids. Wow. It's not just one.
Wow. And you mentioned, and the reason that I asked you to talk about the size is because I do recall, oh gosh, probably about 15 or so years ago, a friend of mine had fibroids removed, and sometimes I think doctors are a bit weird. So they gave her the pictures of the fibroids. It's like, why would you do that? But okay. But and I remember looking at this blob, this mass.
They look weird.
Hello, hence me saying sometimes I think doctors are a bit weird, because why would you give somebody that picture? It looked it reminded me, if you maybe look at some of these science fiction back in the day movies where they had like the blob or something, it literally just looked like this mass, this blob, and it looked huge.
Yeah.
I couldn't actually quite believe what I was seeing, and I was looking at her like, sorry, where was that? Kind of thing. Like, where were you holding that? And she was saying, that's why my stomach was always so big and my stomach wouldn't go down. That's why I wanted you to touch on the size of fibroids, because of having seen that picture, and was kind of very freaked out about that picture.
But honestly, if you think about the fact that some women will look genuinely pregnant, you will look at them and think that they are in their 3rd trimester of pregnancy. Wow. Because of fibroids, they can be really big. Wow. And imagine how uncomfortable that must be.
Yeah, because obviously, like you said, if it's pressing on your bladder or your nerves or your bowel, then of course that must be, oh my gosh, that's just listening to that. And you said, and there are treatments. Please, yes. What are some of these treatments?
So treatments will vary according to each individual and each patient. And I really believe in patient-centered medicine, just as like an aside. So I think that treatment should be tailored to the individual and what they want and what their needs are. So for example, if the main issue actually is heavy periods and pain, what people can actually have is they can actually just have a form of contraception. So usually what they actually like to prescribe is the Mirena coil. And the reason they prescribe the Mirena coil is because it can secrete a low dose of progesterone, and it can therefore reduce the sort of how heavy the bleeding is. And that has actually been shown to be quite effective for a lot of women, not even just with fibroids, but for a lot of women with heavy bleeding and heavy periods. So, and actually one of the things that I was told sort of in med schools how it revolutionized women's health and medicine in terms of like reducing the number of women that have had hysterectomies because they've been able to control their bleeding. So that's number one with the Mirena coil. Number two, you also have other treatments with things like surgical treatment. So you can have what we call myomectomies, which is just remove. So you can remove the fibroids themselves. That can be done open, or it can, so that they actually do like a massive incision, or it can be done laparoscopically, so with smaller incisions, and that depends on the size, and that should help remove the fibroids. And that can often be an option for women who are wanting to complete their family and they haven't yet. And the reason that people might do this is because fibroids, when they're really big, they can distort the shape of the uterus, and that can make getting pregnant more difficult. So removal of that can help to try and restore the cavity, the shape of the cavity. And sometimes if they have a fibroid inside the cavity as well, it affects implantation. So myomectomies can be used to remove that. And they can also help with some of the other symptoms, sort of the pressure symptoms and things like that, because obviously you've removed the mass that's causing it. So that's quite good for women who haven't completed their family and would like to. And I do know a few women that have actually had that in order to complete their families, and it's been pretty successful. And then there are other things like uterine artery embolization. So that's basically cutting off the blood supply to that fibroid. Mm-hmm. They tend not to use that for women unless they've completed their family, because it can affect fertility and things like that. Obviously, there are also hysterectomies, and some people might opt for a hysterectomy as well, if they've completed their family, if they're sure that they don't want to have any children, then hysterectomy is a good option as well. And sometimes, you know, in women who are nearing menopause as well, they might opt for a hysterectomy. So yeah, there are a lot of options. There are. So yeah.
Yes, thank you for that. And a quick question for you. So once you've gone through one of these treatments, depending on, as you've mentioned, what's best for you, can fibroids grow back?
So this is the wonderful and annoying thing about fibroids, is they can grow back. And so that's why, especially with the myomectomy, sometimes they can be a bit, they can sometimes put it off a little bit, and they will say to you like, oh, it can grow back. It's very much an individual basis. So for a lot of women, they do grow back, but it's difficult to predict who it's going to happen, right, you know, to and with. And so yeah, that's just an unfortunate thing, that they do grow back, especially, you know, if you're a woman who's menstruating, those hormones are a fibroid's feast.
Oh, I like how you put that. Those hormones are a fibroid feast. Okay. Well, thank you so much, Wumi. There's so much to learn and to discover. And it's just a shame that we have to go to these lengths to actually even begin to learn, because as I mentioned to you, and I'm glad that you mentioned and help me with the pronunciation, the dysmenorrhea and what was the other one? The menorrhea?
Menorrhagia.
Menorrhagia, right. So I was diagnosed with both of those, two different things, in that you can have one without the other, right? You can have the heavy bleeding, and you can have the really excruciating pain, because I had both. Because I remember my doctor saying to me, it's like the pain is so severe, I'm in labor every month. Thanks. And I was like, okay, this is great. So what are you going to do? And they never actually prescribed they didn't even prescribe any pain meds for me. Yeah. But they told me that this, like, you have this, no, on your way kind of thing. And it was, I had to then ask for things. And because, as you mentioned, over the counter pain meds did not touch it at all. And so it was having to ask for things. And when I was diagnosed with adenomyosis, now, as I mentioned, I had gone through all of my teens into early 20s, constantly anemic. I was like, every 6 months I was going to have blood tests, and then they would say, oh, you're anemic. Like, surprise, surprise. You're anemic. Here's a month's supply of iron tablets. And it was just this cycle for years, from my early teens, just this cycle for years and years and years. And eventually going through life, and it was a girlfriend of mine. She used to live in Birmingham, England. She now lives in Texas in America. And she says, demand a laparoscopy. So I'm like, what's one of them? So she explained it to me, and I says, okay. And so after the final time of being at work, passing out, constantly being sick, and it was my manager that actually took me to the hospital. So I went to my gynecologist and I asked for a laparoscopy. And he says, well, why do you want one of those?
Just for fun. Done.
And I remember my response to him was, because I'm tired of this thing putting me in the hospital. He's like, oh, okay. So he performed laparoscopy, and he's like, afterwards, getting like the results, he says, oh, you have what's known as adenomyosis. I'm like, what's that? And he didn't answer me, but then he just went on to say, oh, you've got 2 options. And I'm like, oh, okay. Options, this is great. Options is good, right? These are the options. You ready? You can either learn to live with it or have a hysterectomy. Those were my options. So I says, thank you. And I left. Needless to say, I never went back and saw that doctor, because it was
I'm not surprised.
Because it was like, hold on a second. You still haven't answered me as to what it is, but yet you're telling me my only 2 options are I can either learn to live with it or have a hysterectomy. Okay, thank you very much for that, because that was, of course, clearly not very helpful. So that is why, knowing that you're a doctor, and when we had spoken, you had shared with me that you're also a doctor and a patient with regards to how the challenges you face with your own peers. That's why I wanted to share this with you, to let you know that, hold on a second, if me, who is not in the medical profession, I'm experiencing that, and you who are in the medical profession experiencing that, what can we do?
What can we do? You know what? Honestly, I think it's a shame that the onus is even on us to do anything about it. I think that's sad. But I think we need to just keep having these conversations. We really need to keep having these conversations and just empower as many of us as we possibly can to advocate for ourselves. Like, we can't just take no for an answer. I mean, like, times are changing, medicine is changing, and we shouldn't be left behind. So our health is important, you know, how we feel is important. And the thing is, it's not just a physical thing. And this is what I think people don't understand. You know, a painful period, even if there's no cause, even if we can't find a cause, okay, that can really affect someone's mental health. Why should anyone have to suffer in this pain? Like, it doesn't make sense, especially when there are options. And so we really need to come together and to really fight and advocate for women's health. And there needs to be better education for healthcare professionals as well around these issues. They need to know more. It can't just be like, oh yeah, well, you know, this is what happens, because that's not our job. Isn't just to be like, okay, yeah, well, okay, that's what happens, and send you on your way. Our job is to actually investigate, try and find as many treatments. I'm not saying there's always a treatment, and I'm not saying that there's always a diagnosis. What I'm saying is it's our job to at least try.
Yeah.
And if we don't find anything, okay. And then we can think about more holistic care. What are the things we can do to take care of you in your entirety? How can we look after your mental health? How can we try and find things that will actually make it a little bit easier for you? What are the support groups? There are support groups. So what are the support groups that we can direct you toward? You know, it's more than just saying, oh, sorry, you've got a period, and just live with it. It's more than that. And there needs to be better education, and there needs to be funding into research, into women's health, into Black women's health.
Sorry, you said there's support groups. Why am I only just hearing this? Like, what?
Do you know what? Yes. And the thing is, obviously, we are lucky now. We have the benefit of like Google. I'm not even going to pretend that I know the answer to everything, but the point is, like, we can actually, it's so easy to type in, and there are endometriosis support groups, there are adenomyosis support groups, there are fibroid support groups. They are there.
Wow, that's good to know. A bit too late for myself, but it's good to know, because to, like you were saying, and I'm glad that you said that the onus isn't on us as the patient to be able to do our own research and figure it out. Because as I said, honestly, when I asked him what adenomyosis was, there was no response from him. I did my own homework, my own research, and it's considering that, okay, when you go to either your primary care doctor, your GP, I can imagine, okay, they're just a general practitioner, so they're not the specialist in any one thing. But the doctor that told me this is a specialist. He's a gynecologist. And I know I'm saying it like that. He was my gynecologist. So therefore, that is actually his area of expertise, is it not? So he really should have been better and more well-versed in what I could, A, being able to at least tell me what it is, B, offer me some resources other than the two options of learn to live with it was the first thing he said to me. You will either have to learn to live with it or have a hysterectomy. And he is a specialist in that. So it's one of those things where, so why aren't even those who are specializing in gynecological care not caring more and doing more to help?
You know, when someone's lost for words, I'm lost for words. I am lost for words. Honestly, you know, the thing is, and just one thing is that even your GP should know. There are things that, because GPs are generalists, but they are trained in understanding a lot of things. They might not know, they won't be a gynecologist, and that's fine, but they will be able to give you, they should be able to give you some sort of overview on what that condition is. And because if you bear in mind, you're not only solely going to be looked after by your gynecologist. You're you know, a lot of especially in the UK, a lot of it is primary care led. And so the person that's going to be looking after you, that's going to be seeing you regularly, you're more likely to be able to see your GP than you are your gynecologist.
That is true.
They should know about it. But now I've said that bit, the gynecologist, it is on them as well. It is on them as well to give you all the resources. They're the specialists. Who's going to know better than a gynecologist? What the treatment options are, how to take care of it, what's out there. It's on them. And it really, there needs to be a shift in mindset. There needs to be a shift in, you know, just caring about women, caring about women's health, caring about Black women as well. There needs to be that shift.
That is so true. Thank you. Thank you so much for us going into, and I know, again, as I said at the top of this conversation, talking about periods, it's quite a taboo subject. Why? I'm not quite sure. And again, but people are very uncomfortable talking about it. But I want to shift slightly, because the other part of your event was menopause. And I was looking into it, and this is quite interesting. Research shows failing to accommodate menopause costs an unbelievable £10 billion to the UK's economy, and more than $26 billion a year to the US economy. And women between the ages of 45 and 54 make up 20% of the female workforce here in the US. And that is as of the end of April 2023. And it's interesting that we're looking at this and we're talking about this, because I'm thinking, as far as many people are concerned, right? All menopause is you no longer have a period and you can't have children. That's it. Full stop, end of, right? But or some people have a little bit more knowledge in that they know that, oh, so you get hot flashes and you get the night sweats, and it might disrupt your sleep a little bit. And to be honest, like, so that's it. What's the big deal? What? So what? The worst part of it is over. You don't have the periods anymore and you can't get pregnant. So, and then, the thought is, so you should be happy, right? You're going through menopause. But if we look at the impact on the economy, both in the UK and here in the US, it's staggering that we're looking at a combined, more than $26 billion, 10 billion pounds. But yet we're still having these conversations and women are still not being accommodated in the workplace. There's no accommodations being made to help support. Now, I'm going to throw a really big question at you. Right?
Okay.
So firstly, no, let me take a step back before I throw that question at you. Let me prepare you.
Okay.
So firstly, if you tell us, yes, menopause is when your periods stop, but what else comes with menopause?
So, menopause is when your period stops, but it's actually when your periods have stopped for 12 months. So if you've had 12 months of no period, then you're in the menopause. Before that, it's perimenopause. And with menopause comes a whole host of symptoms. Like you say, like you name it, probably it can be a symptom of menopause. People come in with changes to their bowel habits, brain fog, insomnia, a lot of difficulty sleeping, changes to their mood. Don't forget, this is a hormonal shift. So mood changes, low mood, changes to appetite, weight changes, so many different things, headaches, you name it, menopause can be associated with it. We've said about the night sweats and the hot flashes. Those are the ones that people most commonly know as well. But yeah, there's a lot. Literally, you name it, can happen in menopause.
Wow. And it's quite interesting because, again, it's something that has been happening forever, but so little is known about it.
Yeah.
Like, why?
So I've really tried to think about, why do I think nobody really knows about menopause? And I know I feel like I'm saying this word a lot, but I do think it's a patriarchal thing as well. I think one of my theories anyway is that for a long time, our roles as women, cook, procreate, and then raise the kids, right? Mm-hmm. So why does anyone care when you're not doing that anymore? That's genuinely part of what I think the problem is. Like, everyone's like, okay, well, that's it, you're done. Which is wild, because that's not the value in any woman. In fact, that is not our value. Yes, it's a fantastic thing, but that's not our value.
Yeah.
So I think that is one of the reasons why it's not spoken about. And I think it's, I don't think there's been enough research into it. I think that even for healthcare professionals, we don't all really know. Like, I won't say that, I think obviously we know what it is. We know there are some options, but hormone replacement therapy and things. But in terms of like in-depth insight, I have to say that the Martini's Menstruation and Menopause event, I was learning things on the spot about menopause. I was like, wow, interesting. So yeah, I think those are I think those are the key things around why people don't know about it. Honestly, I don't think people care.
And that's actually quite sad to, again, referencing that you are actually in the medical profession. You are a doctor, and not just a doctor because you've got a PhD and we call people a PhD doctor. You are actually a medical doctor. And these are the struggles and the challenges that you even face. You obtained your medical degree from University College London and a neuroscience graduate from King's College London. So again, I say that to say, not because I'm throwing your credentials out there, but you are actually a medical doctor. And these are the things that you discover, and this is what you feel like. So what can us, like the regular everyday woman, what can we even do about it then?
So I think it, again, I do think it does, it does boil down to, unfortunately, the onus shouldn't be on us, but I think it, we do have to advocate for ourselves until, there's a complete shift. And, I don't want to be all doom and gloom, because I do think that at least the doctors I've experienced and that I know and that I work with, we have a vested interest in patients and their lives. But that's why hopefully that's why you do medicine, right? Because you want to make people's lives better. But unfortunately, we just, as a world and as a society, haven't really got to a place where we've prioritized this group of people's health. We haven't prioritized the health of people that menstruate. And so until that happens, we have to just push, we have to advocate, we have to fight, we have to just, if you think that this is what you're experiencing, something as a result of your periods or menopause, you think you might be going through menopause, some of the things that you can do. And this was something that I think one of my friends mentioned recently, speaking about just periods in general and where there's a problem, was diaries, keeping a diary of your symptoms. Like, this is what I'm feeling. So on Monday, I felt this and I felt that. And even if you can't kind of find trends or, just keep having a log of this is what's been happening to me, and taking that to your doctor and saying, like, look, these are the things that have happened. I've had this constellation of symptoms. And that way you can actually see trends over time. But you can also, sometimes it's hard to remember. Like, I can't remember what I felt last Wednesday. So noting it down that actually last Wednesday I had a bit of this and a bit of that might be something you can take to your doctor. And also it means that they can tailor their management according to what you're coming with. So if it's like, I've come in with, vaginal dryness, you can go to your doctor and be like, I've had vaginal dryness. And they can say, okay, here's a cream, here's a topical estrogen that's going to make that better for you. So there are, little things that you can try and do to present to the doctors that might help guide them in the right direction about what to do for you.
That's good. I like that, keeping journaling it and keeping a diary of what's happening, because it's so true. Because sometimes by the time you're able to make the appointment and get to the doctor, you've forgotten some of the things, and the doctor can only really treat what you told them about anyway, right?
Yeah, exactly. And especially because GP appointments in the UK they're 10 minutes. So you're under pressure to make sure that you've got the main point. And I know, I'll get off the phone, I'll be like, oh gosh. And there was one pain I had, so and the doctor can't know. So yeah, it's good to just have written down exactly what you want to discuss and what the problems are. Just jog your memory a bit.
Oh, that's good. And I know it might seem like, oh gosh, why do I have to do this? But honestly, for your own sake, and not just for your own physical health, and you mentioned earlier, for your own mental health as well, because this can be sometimes, I think, as well, and not that I want to speak for other people, but watch me do it. It's one of those things where you sometimes you feel like, am I going a bit crazy here? Am I imagining this? Is this really this bad? Am I making a big deal about stuff? And you start to question yourself, and you start to question your own sanity. And I don't know, again, if it's just me, but there were times I'm just like, is this right? Is this? And then I, again, as Black people, there's many times you look at it, it's like, oh, but you don't want to keep going to the doctor because you don't want to bother the doctor. And I don't even know why we got that, where we get that from, because it's the doctor's job for us to bother them, to go to them with stuff, right? But yet we don't want to bother them, which, okay, I'm still trying to figure that one out. But it's keeping that journal so that it's one of those things where, like you said, you can say, look, this month I went through this. The month before I went through this and this and this. So like you said, you can see what the patterns are. And if there's a common thread in it,
Yeah.
Again, there could be things that we're going through that actually are quite serious, but we keep forgetting to mention the doctor. Like when you said after you finish, you're just like, oh, and I'm sure we've all done it. We've left the doctors and we still in the building when we remembered something else.
I was just like, oh damn, gosh, I should have had that.
And the thing is, my mum's gonna watch this and like, oh Lord help me, because my mum's always telling me to write it down.
Your mum's right.
Yeah,
Your mum's right.
yeah, and I kind of don't. Okay, it's like,
We're sorry, Mum. She's gonna write it down from now
I
on.
know, right? Hang on, right down. Take note of this. No, seriously, my mum's always back then. My mum worked in the medical profession for 25 years. So, and interestingly enough, she worked in the OBGYN, obstetrician, gynecology, and obstetrician. So she kind of, now that I think about it, she probably knew what she was talking about.
You know, I think so.
So yeah. So anyway, sorry, back onto serious subject. So with that and with regards to menopause, so thank you for that, because I know that, to be honest, I was quite ignorant about menopause. And I remember I had this manager, she was going through menopause and she would have these hot flashes and she would be like, oh my gosh. And then I'd look at her and she goes, don't laugh at me. Don't laugh. This is going to happen to you one day. Don't laugh at me. And I was like, what's wrong? What's wrong? And then I started to do my own research and I thought, okay. Okay, she's clearly going through something, and let me just try and be as sympathetic and helpful as possible, because clearly this is something that, and she was in senior leadership as well, having to deal with this and in a lot of meetings. And fortunately for her, I'm going to say this was pre-pandemic, so we didn't have video calls and so on the way that we do now. So she was at least able to hide behind her phone when she was on calls with some of the other senior executives, having a hot flash and fanning and all the rest of it. But there is a lot to learn and there's a lot to unpack. And I would really encourage us as women, and not just us as women, but really us as women, because we're the ones that go through it. And in order to help our doctors help us, we need to at least have an understanding of what's going on. So I would encourage us to do our research, to look into if your period is, if you think it's too heavy, because to your point, because believe me, I know what it's like it's like you're sitting down and you don't want to stand up for love nor money, just like, can I just wheel myself around in this chair forever? Or you using sanitary products and using the maternity ones and having to change every 30 minutes. Been there, done that. So, and if you're in excruciating pain and the over-the-counter medications are not helping, just pay attention to these things and don't just pass it off as it's some kind of I am woman, hear me roar kind of thing, because it's our rite of passage, because we're supposed to know. As you said, woman, that's actually could be signs that something is wrong. So we need to look into this. And also, women, pay attention to your iron levels as well, because you can be iron deficient and not anemic. Who knew? I found that out when I was going through it, that I was iron deficient and not anemic, which was like, oh, but then I also had many years of being anemic to the point of like 2 blood transfusions. It was that bad. So we need to pay attention. My final note on that really is as women, we need to pay attention to the symptoms, what we're experiencing. Don't be afraid to speak up to your doctor, and don't be afraid to advocate for yourself either. That's very, very important. Do you agree?
Yeah, I agree. And I just want to add, be kind to yourself. Like women, just in general in life, we all need to be kind to ourselves. But women, we need to be kind to ourselves and take care of ourselves. Like your health matters, you matter, your life matters, your mental health matters. And so prioritize that. Don't let anyone tell you that it's not important, because it is. And if you're worried, see your doctor. The best thing is to see your doctor and find out that there was nothing, but it's worse to see your doctor, to not see your doctor and then find out that it is something. So, yeah.
I like that. I like that. I like that. Thank you so much, Ifewumi. Thank you. And now I'd like to speak about Shake Africa. Now, there's so many areas that Shake Africa cover, such as health awareness, sexual and gender-based violence, cervical cancer screening, gender-based violence, breast ironing and breast flattening, something I'd never heard of until I was researching about you and looking at your website, and female genital mutilation, also known as FGM. Now, first of all, Wumi, why Shake Africa, and why did you form Shake Africa?
So Shake Africa actually came about when I was in medical school, and I was volunteering for an organization called Sexpression. And it was all about improving sexual and reproductive education in the UK. And I was like, I'm from Nigeria, and this would be fantastic in Nigeria. So it initially started off as just trying to raise awareness about sexual and reproductive health within Nigeria. That's also a taboo. Anything around that is a taboo. So I thought, let's get conversations started, because like I said before, if people don't know, then people don't know when there's a problem, people don't know what to look out for, and people don't know how to protect themselves and keep themselves safe. So it started off like that. And over the years, it's sort of expanded and it's evolved to really think about women's health in its entirety. And it's all about just trying to make sure that we are taken care of, that our health is prioritized, that people know what to look for, people know when there's an issue, and people feel like they can speak up about what's going on with them, that they feel like they can look after themselves, because that's what's going to transform health outcomes. That's what's going to mean that people are living longer, but not just living longer, but they're living longer, healthier lives. It's one thing to live a long life, it's another thing to live that life and enjoy it to its fullest. And Shake Africa wants to ensure that women can do that.
Lovely, thank you so much. And it's wonderful to see a young lady such as yourself taking the knowledge that you're learning here back to the country that your parents and grandparents are from, and bringing education and raising awareness there. Now we know, unfortunately, that some of these countries, as you mentioned, like some of these African countries, Caribbean islands, and so, that could also be some, not only those, but also some Asian countries as well. The subject of women's sexual health and reproductive health is extremely taboo. If we thought speaking about periods was taboo here, it's even more so in these nations. So have you faced any obstacles and challenges in trying to take this type of education to Nigeria?
Yeah, so it's definitely, so I'm going to say I've been, yes, and then I've also been pleasantly surprised. So I think it's always difficult, even here, it's always difficult. I feel like even some of the conversations that I've had where people are a bit like, has been in the UK, where people are a bit like, oh, I don't know, is this something we really need to talk about? So I think actually as a world, we're not necessarily all very ready to speak about sexual and reproductive health. And within, I think there's something about respecting the cultural context that you're in as well. And you don't have to rush things. Sometimes you ease people into things. And so even like in Nigeria, where I've Shake Africa, we've held some like period parties. The way that we shape things and frame things, it doesn't mean we shy away from the truth, but sometimes we do it in a way that we think is more culturally sensitive, or we try and involve the culture more and think, well, how do they like us to teach, right? It's not me coming here and going there and saying, this is how you have to learn, but this is, how do you want us to teach you? And we teach you in a way that respects your culture, but still gives you the facts. And I think that's really important. So yeah, there have been difficulties, but then also, like I said, I've been pleasantly surprised where I think that people are ready to hear about it. People are ready to learn. And both women and men have actually been very sort of open and accepting and curious. Honestly, there's a lot of curiosity and people do actually want to hear about these things. So yeah, I think I can say a bit of both.
That's excellent. And I like how you do that. You teach in a way that's respectful of the culture. You don't just go in there all guns blazing, like, no, you must do it this way. So I appreciate that. And I'm sure they do too. And I just really wanted to touch on a couple of things that I saw on your website that was just like, wow. So one of the areas that you cover is gender-based violence. And looking at your website, it says globally, it is estimated that 1 in 3 women experience either physical or sexual intimate partner violence or non-partner sexual violence in their lifetime. What is it that you do in bringing awareness to a subject such as this in Africa?
So each year so one of the things that we do actually, and this is our main thing, so there's a 16 days of activism campaign that happens every year that's run by the United Nations, and they basically 16 days of activism against gender-based violence. And so each year we will do work around that, and it normally runs in between November and December. And so what we do, a lot of our work is actually about just mostly awareness raising. So getting the conversation started, getting the conversations going, and showing people what gender-based violence might look like. So we have one idea. A lot of people kind of believe that gender-based violence is very much just this man and a woman in a house and the man beats the woman. Okay. And that is violence, right? That is violence. A man is assaulting a woman, that is violence. But there are other things. There's coercion. There's, there's financial abuse. There's psychological and emotional abuse. And so what we try and do is shed light on what it can look like, and signpost people to organizations in their country that they can approach should they be in these situations. And then with 16 days of activism, we do an event. So like last year, we had an event in December where we spoke about gender-based violence. And yeah, these are the things that we have to do around it.
Thank you. And looking at your website and some of the work that you do with Shape Africa, now I've heard of FGM or female genital mutilation before, but I'd never heard of breast ironing or breast flattening. And before I even go any further, there's something I read on your website that I absolutely love. So before we even go into female genital mutilation and breast ironing, I must preface that I love how you put it. And you said, and I'm going to read this from your website. It says, excuse me, in communities where these things are practiced, it is often done with the mistaken best protective intentions, clouded and justified by culture, custom, and religion. It must be said that no religion prescribes this practice nor promotes it. It is simply a ritual of girl-child abuse and violence against her body, a form of women perpetrated violence and mutilation on girls. Wumi, I absolutely love that, because so many people believe that they're doing things in the name of religion, right? And like quote unquote on religion. So many people are mistaken and misguided into why they are doing and continuing with these absolutely horrific practices. And a lot of it really, as you said, it's ignorance, and it really is abuse and it's violence on women and young girls at that. Because to have again looking at doing some research around, it's young girls, it's girls that are prepubescent where these things are being done to them. And something that was staggering to me is that yes, we look at some of these things and we think, oh, it's only done in these countries like these African nations or these Asian countries or these West Indian countries, but around 1,000 9 to 15-year-old girls in the UK are currently thought to be at risk of breast ironing. We haven't even touched on the FGM because we know that happens as well. And this is actually quite staggering and alarming that these things are happening in countries like the UK and the US. What is Shake Africa? First of all, please tell us what breast ironing and breast flattening is.
Okay, so breast ironing and breast flattening is honestly, it's really what it says. It's basically trying to use methods to prevent breast growth. And it's generally rooted in this idea that that you don't want a woman to be, or a child to be viewed sexually, or to be, to grow these organs that are natural, but to grow them so that they're not seen as promiscuous, or they're not very sexual, they're not they're not seen by men's eyes. So it's using different methods, maybe like using stones or like binders to flatten breasts so that essentially they don't grow.
Wow. And you said, so it's to stop young girls growing into womanhood, or the physical appearance of womanhood.
Yeah, pretty much. It's basically just to to stop that physical appearance of womanhood, to stop the breast growth so that they're not seen sexually.
Wow. And looking again into the research of this, it says breast ironing affects 3.8 million women around the world and has been identified as one of the 5 underreported crimes relating to gender-based violence. So it's up there in the top 5 of underreported crimes. This is, I mean, how this. When I read that, I really, really was at a loss for words. And I think one of the saddest parts about breast ironing and also female genital mutilation is that, and you mentioned this on your website, and I mentioned to you about a book I read where a woman in Sudan went through this, because the practice is commonly performed by family members, 58% of the time by the mother. Like, Wumi, how do we stop this? Like, how do we stamp it out?
Honestly, I think a lot of it boils down to education and reaching communities. You said it, a lot of people, I want to steer away from villainizing, because I think that it's a terrible practice, but a lot of people really think that this is part of their religion, their culture, that this is the right thing to do. And they don't understand the implications of what they're doing. They don't understand psychologically what it does, physically what it does. And so it is about educating people to understand that, this is not from your religion. And a lot of people are shocked. They'll be like, oh, I thought that this was meant to happen. I thought that I had to happen. And you need to bear in mind that often is the people that these things have been done to as well. So they do think it's part of the rite of passage. They do think that this is what's meant to happen. And so it is trying to make sure that we are accessing communities, that we are speaking to people, that we are getting the word out there. Like you said, you hadn't heard of breast ironing. I hadn't heard of breast ironing. It was one of our volunteers that even brought it to my attention, one of my volunteers that works in Nigeria. So it's not something that everybody knows about. And it is shocking. So the more we get people speaking about it, the more we get sort of the ideas out there, and the more that we try and galvanize support and get support from governments, from policymakers, from people even at the people at the grassroots levels, then the more we're going to be able to access people and ensure that these things become a thing of the past.
100%. Thank you for that. And and to your point, we don't want to villainize anyone, because again, it really is not anything that I believe they're doing for malicious purposes, but it's because they believe in their culture or some religious practice that's being done. So the more we educate people, the more these barbaric, for want of a better word, practices get stamped out. And just want to touch on also female genital mutilation, because that's something that Shape Africa brings awareness and education around. So again, statistically speaking, 200 million girls and women alive today have undergone FGM.
Yeah.
So, and it says at current rates, additional estimates of 68 million girls going through FGM by 2030. So 200 million girls. And we're not talking about 200 million girls and women in the past. We're talking about alive today, 2023, have gone through this. And Rumi, please tell us, what is female genital mutilation, or FGM?
So FGM is, we'll say, cutting of the female genitals, and the key thing is that it brings no sort of there's no medical reasoning for it, or no medical benefit for it. And there are different types of FGM. So there's 4 types, and it can range from sort of clitoridectomy, so like removal of the clitoris, to complete removal of the female genitalia. So the clitoral hood, the labia minora, majora, so basically the sort of the lips of the vulva, and then infibulation, where they then sew it up as well, and they just leave a small hole for menstruation and for the period to pass. And there are various types. So some people call it female circumcision. Generally, I don't like to use that term, because I think people then try and say it's the same as male circumcision and things. But it can also be cutting. There are things like labia pulling, and there's different types of female genital mutilation. But yes, that's basically what it involves.
Thank you. And I actually was going to say to you about female circumcision, because prior to hearing it termed as female genital mutilation, I had for many years heard about female circumcision. And obviously you hear it like that, and to your point, you think it's like male circumcision, right? So you just think, it's nothing really. And some people, like, for example, male circumcision, think, oh, well, it's more hygienic anyway, right? So because it has that word circumcision attached to it, you don't actually think it's as severe and as damaging and as harmful as it is, right?
Yeah, exactly. Sometimes people don't recognize how damaging female genital mutilation can be. And honestly, it can be damaging. Some of the things I've heard, some of the stories I've seen have been terrible. Honestly, it has a lot of it's associated with a lot of medical complications, from chronic to fertility issues. So it can be really bad.
And the worst outcome, it can also lead to death, right?
Yeah, it can lead to death. It can lead to death.
That's, my gosh, that's we need to do all we can to stamp out these practices, because again, to your point, it's nothing short of violence against women and girls underage at that, because I can't imagine at the age of 9 going through the breast flattening or the female genital mutilation or just any of these practices. I just can't begin to imagine. And we've got some of our girls and women around the world going through this. So, Mummy, what can we do to help support education of women around the world? What can we do to support Shape Africa in bringing education and awareness to people around the world to stop and stamp out these practices?
So one, my favorite thing is conversation. I really do think conversation it can transform a lot of things. Once we start talking about it, we get more comfortable speaking about these things. And don't get me wrong, this is a difficult issue to discuss, but actually speaking about it and having conversations like you and I are having now, like the work that you're doing, your podcast, like you're reaching people and you don't know who you're going to reach with this. That's the thing. You can reach somebody somewhere across the world who will hear this and they will be like, wow. Or they will be like, this has been done to me. So some people think that also some people don't really know that it's happened to them. Sometimes it's happened so young. Other times they think that this is just normal. So actually having these conversations and reaching people. And then, speaking to your policymakers, speaking to your MPs, speaking to them about what they can do, what kind of policies that they can have, what structures that they can have, what infrastructure that they can have that would best support, women and girls. And I do think it's about galvanizing men's support as well. So in a lot of these societies or communities where FGM is taking place, a lot of them will look at elders in the community or they'll look at men in the community who dictate a lot of, the way that the communities run. And sometimes it's about educating them and getting them to be able to speak to the men in their communities and to speak to the women in their communities and just get that conversation going within them. And I think it is, we're speaking about villainizing people. I think it's about not villainizing. We're not saying support it. I'm not saying say this is right. Absolutely not. But actually speaking on a level which is like, I'm not here to say you're wrong and no, I'm here to explain to you why. Actually, a lot of people don't know that this can happen. People don't know. A lot of parents love their children, for example. They're not trying to kill them. So actually, do they know? Do they understand the health implications? Do they know what could happen? And making sure that they're aware of these things, opening their eyes to the fact that this isn't a religious practice or it's not required by religion. And then also just having events as well, come to a Shake Africa event, support a Shake Africa event, support your podcast, things like that. Just get ourselves going and moving and talking about it. I think we can actually make a huge difference.
So thank you so much. And I'm glad you mentioned also men getting involved, because that's something that when we were talking about menstruation and menopause, something that I was remiss in mentioning. Yes, we're talking about women pay attention to what's happening to your body, women journal what's happening, women advocate for yourself when you go to your doctors. But one of the things also is the men in our lives, if they're thinking, oh, is this right? Especially if they've grown up with sisters and so on. Like, well, my sister didn't go through that. So is that normal? Is that right? So we should also be able to have these conversations with the men in our lives as well, right? And I'm not saying that we need to always go into graphic detail, but even if women touch on some of these conversations with their sons, so when their sons are in relationships with women, they will be able to help. Or not only that, if and when their sons have daughters, they will be able to say, okay, my daughter is struggling, this isn't right. And it shouldn't just be seen as the quote unquote women's problem. It's women's issues, because the reality is it's not just women's issues, is it? It's all of our issues, because if we're not functioning, many times the household's not functioning either, really, is it?
Exactly. I think that that's really important, honestly. And every man that has come into this earth, we're all coming through vessels. And what are they? People that menstruate, right? In order for us to be on this earth, somebody menstruated, right? So with that in mind, it's all of our concerns, all of our issues. You said it, if you give birth to, if you or you father a child who has a period, making them comfortable to discuss it with you. I think sometimes, we have to shy around the house, you don't let your dad know you're on your period, don't let your brothers know you're on period, don't be in too much pain around them. If you're in pain, be able to vocalize that, and creating a household where people feel comfortable, where your daughter feels comfortable to speak to you about it and to say, this is what I'm experiencing. go to that doctor's appointment with them if that's what they want. Go with them and talk to the doctor with them as well. My child is going through this. This is what they're experiencing. What can I learn? What can I do? Read about it. Read up on these issues.
That is so true. Because I remember I dated this guy, and it was really short-lived because it was always a case of, oh, it's that time you've got your horns and your horns come out. And I thought, you know something? If your mother had had a decent conversation with you, you wouldn't actually be referring to me during this time when I was really struggling. Like you mentioned, it's not just the physical toll that it has on your body, it's the mental toll, it's the emotional toll, it's the physical toll, the psychology of it and what it's doing to you at that time. And then to have a partner that is that insensitive to what you're going through, that all they can do is refer to it as, oh, it's your horns that come out and you were like this and you were like that. And it's just like, okay, this is interesting. And bearing in mind that this man has a daughter, and it's a case of, okay, how do you speak to your daughter should she be having an issue, having a problem? So again, to your point, normalizing these conversations so that you can have them with your wives and your daughters and your sisters, your mothers, and so on, so that you can actually get that support. And one thing is, if we can stop using PMS as the butt of jokes, right?
Yes. You know how people love a good PMS joke? Oh, you're PMSing. Oh, it's your period. Oh, haha.
Yeah, no, don't get me wrong. I know I've done it, especially, but I must admit, I haven't done it to a woman. I have actually used a PMS joke on a man when he was behaving a certain way, and I would say to him, would you like some evening primrose oil? I think you're going to need it because I think it's going to help with your PMS symptoms. So I've actually never used it as a joke on women, but I actually always found it very entertaining to tell a man that.
But evening primrose.
I'm so sorry. Seriously, but we really do need to stop using PMS as the butt of jokes because it's not helpful. And I think that's as a result of that, and correct me if I'm wrong, it seems like that's actually pushes women back in not wanting to say anything because they're just going to be dismissed as, oh, it's just PMS, right?
A lot of things are put down to our hormones, and I don't want to negate the role that hormones play in a lot of how women feel. But if I don't like what you're doing, I don't like the way you've spoken to me, or I don't like the way you've behaved towards me, it's not my hormones. I just don't like the fact that you've behaved badly, or you've been insensitive, or you've been rude. And we can't always explain away our feelings based on hormones, because I think it does, people can use it as an excuse to get away with bad behavior, like, oh well, she's just hormonal, she's just crazy. Well, actually, no, you just did a bad thing. So I think that's really important. But also, because the hormones can have such a grave and such a strong effects on women, especially women who suffer from or experience PMDD. So they've got premenstrual dysphoria disorder, where they, for like a good 2 weeks out of the month, they will feel completely out of sorts. Wow. Some women can experience psychosis as a result of the hormonal changes that are associated with periods. People can feel depressed, people can feel suicidal. And I think that that's not something we should joke about. And I think that if people almost always dismiss everything as hormones and like it's not that serious, and they don't take it seriously when women are experiencing these things as a result of their hormones as well. So I just think that we need to be more, as a society, just more sensitive around that topic.
Yes, thank you. And I like how you put that as well, and you don't blame me having PMS as a reason you to behave badly and for you to basically just be rude and disrespectful. And thank you for that. And so what's next for you, Wumi, and what's next for Shake Africa?
So next, I'll start with Shake Africa. So Shake Africa, we're just going to keep going, keep having these conversations. Watch out for 16 Days of Activism. We will be running our campaign again in November and December. We have some really exciting events planned. And I will say, just keep an eye on the Instagram and the website. I won't give away too much, at Shake Africa or www.shakeafrica.org. But we have some really, really exciting events. I'm honestly so excited. But yeah, we'll continue speaking about these things. We're not going to stop. We're going to keep pushing for women and advocating for women everywhere. And yeah, and then I'm just going to continue on in medicine and trying to practice what I preach. So making sure that I'm listening to the women that come to me, making sure that I learn more about these issues as well, and just trying to stay on top of it. And then I will be pursuing a master's in October on global health science and epidemiology. And my key thing is trying to understand a bit more about the determinants of women's health, and trying to explore more around Black women's health and maternal mortality.
Thank you so much for mentioning that, because Black maternal mortality is a subject that I've really been wanting to cover as well. So watch this space, because I will be inviting you back for us to discuss that, because I think that is a topic that really needs to have the lid blown off it completely. So thank you for letting us know that's what you're doing, Wumi. And so where can people find you? I know that you mentioned the Shake Africa website, and what are your social media handles? I will also include them in the description of this video as well, but tell the listeners where they can find you.
So you can find us at our website, www.shakeafrica.org. And that's kind of like our information hub. We have our blog posts and some information you can find there. You can also reach out to us on there as well if you have anything you'd like to discuss, any questions, etc. And then in terms of social media, all of our social media is at Shake Africa. And you can find us on Instagram, a little bit on Twitter, and also on LinkedIn.
Perfect. Thank you so much.
Oh, and Facebook.
Okay, Facebook. So it's Shake Africa on LinkedIn, Facebook, Twitter, and Instagram.
Yes.
And your website is www.shakeafrica.org.
Yes, exactly.
Perfect. Thank you. Wumi, it's been an absolute pleasure speaking to you today. Thank you so much for taking the time to join us here. Conversations with Alison Jade. Look forward to speaking to you soon. Thank you so much.
And thank you so much, Alison. It's been fantastic, and keep doing what you're doing. Your podcast is amazing.
Thank you, my dear. Thank you. Thank you. Bye-bye.